Hi guys. I haven't updated you for a while, so I thought that now was a good time. Um, some things have changed in my life, so I thought that it'd be good to let you all know what's happening. Um, so I guess I'll start with the easier things. Um, in Taekwondo, I will be a red belt in like a month, so that's cool. I believe I will officially be advanced rank. That's awesome. Uh, as far as school, uh, I seem to have a bad track record with school because of a lot of different things that have happened, moving and things like that. Uh, I thought that I finally had it where I was gonna graduate. That's one of my life goals. I want to graduate from college, and it things keep happening where it just seems like it's not gonna happen for me, but I'm still going. Right now, so I was going for an associate's in veterinary technology, which would make me a veterinary technician, basically like a nurse, but for animals. Um, I'm unable to continue going because my school was requiring me to train at a place that was AHA certified, so certified through the American Animal Hospital Association, and there are no places within an hour that are certified. Um, I found one actually within the hour. It's exactly an hour away, but they told me no, I can't train there to try back in 6 months, and I don't want to I don't want to keep putting off my life for 6 months just waiting for them to say, yes, you can train here because I can't register for school until I'm training somewhere. And I just don't want to go down that cycle continually. So I decided to apply to the University of Montana. I'm going to be studying administrative management and with an option for social media management. So hopefully I will graduate now. I should have at least 15 to 20 credits that will transfer into that degree, so I should only have to take the ones required for the actual degree, not like English, math, that kind of stuff. I might have to take a math, but it, it's not going to be like University 101. No, I don't have to take that. So that's good. Um, yeah, so I hope to graduate sometime soon, I guess. A year or two. Hopefully, not more than two. Uh, but this degree is an associate's, so I'm taking baby steps because I don't want to apply for a 4 year degree and then not be able to finish it because that just it's overwhelming to think about. So if I can do little steps, I can get my associates, and then if I decide to keep going, I can go and get whatever bachelor's I want, business, anthropology, whatever, and it'll eventually, I believe it's going to work out for me. And I'm going to graduate. It's going to happen because I want this. I've been trying for, let's see, I graduated in 2006. I started college in 2006. So it's been almost 10 years that I have been trying to graduate from college. And I am proud to say that I have done it all on my own. I've had no like parental help. I don't have parents. So I I have no adult help, and I feel like I've come a long way in life, pretty much. Uh, I've done everything on my own. I've rented on my own, everything. So I feel like I'm at a pretty good point right now for not having any guidance or help in any way. So I'm getting there. uh, so yeah, right now I'm still working at Subway till I can accomplish my goals. I don't plan on leaving. It's like the easiest job ever. Plus, I don't know if any of you guys have ever had this experience, but Subway as a company, I don't know how they stand, but as far as the owners that I've worked for, they are very trans friendly. Um, when I came out at work, I worked at Subway just in a different city, and they were fine with it. They changed all my records and everything, my name and everything. And then I moved an hour away, and some of my coworkers found out and told everybody. What I personally don't care. Uh, no one treats me any differently or anything, and the owners were like, "Oh," like they didn't care, which I think is pretty great for being in a tiny town in Montana. Um, yeah. As far as other goals in my life, I want to try to lose 20 pounds over the summer by like September-ish. Uh, I don't necessarily care if it's the pounds or like just the body fat because I seem to put on muscle really easily and it makes me bulkier and kind of feel fatter. But I think it's just because I haven't had surgery yet. So I feel like I'm working on my chest and stuff, and it's getting bigger, but there's still fat there, and it's makes me feel fat. So it's not necessarily the pounds, but the fat that I want to lose. So yeah. I also set a goal for myself to read 15 books for the year, and I've only read 5, so I want to try to read at least 3 or 4 over the summer so that I can catch up with my goal. I think that I'll probably read a lot more like October through December because of the snow and I won't be able to do much outside. Um, so, but at least 3 over the summer I think I should be able to get done. And I want to keep another goal is to keep saving for my surgery and for a down payment on a house because we're trying to do that also. Um, as far as surgery, I have chosen a surgeon, and I want to explain everything because I know that my friends in Pittsburgh might be mad. But the surgeon that I chose, her name's Dr. Corey Agarwal, and she's at the University of Utah in Salt Lake City. Uh, the reason I chose her mostly is because she's very close to home, and the travel cost is not going to be nearly as much as it would be. So, at first I was going to go to Cleveland, and I had plans to see all my friends in Pittsburgh, which I really liked that idea a lot. Um, but it would cost me about an extra $2,000 to get there and do that, plus the surgery is more expensive. So, 2,000 in travel plus probably another about 2,000 for the surgery. That's crazy. Um, to for me to drive to Salt Lake City, we have a Honda Fit, so it's gonna cost us, I don't know, $60 to get there, and then we're gonna stay for probably 2 nights, which is probably, I don't know, what, $150 at the top end, maybe. And then we're driving home. So I get to recuperate at home, which I like that better than staying in a hotel for a week. Uh, and then I have to drive back to get the drains taken out. But I feel like I'll feel a lot better being at home with my kitties and my dog instead of being in a hotel away from home. Like, I don't know. I would get to see my friends if I got to go to Cleveland, but I also am not so sure, like, I'm gonna be all, like, drugged up and not able to do a lot of things, and I feel like being able to come visit at a different time would be better because I can actually hang out and do things than just be half dead, you know? So, there's that. Also, so my surgery, instead of costing like $7,500, it's going to be somewhere between 5,500 and 6,200 ish. Um, I haven't had my consultation yet, so I'll know an exact amount when that happens, but that's like the range that I've seen from other patients. I do like the results, and the cost is cheaper because it's at the University of Utah and they use the university's facilities, so I guess that makes it not as expensive as a doctor using their own facilities. I don't get it, but works for me. Um, I am also applying for a grant through the Jim Collins Foundation to try to get the rest of the money for the surgery. Uh, I have saved some, and I have about $300 through my fund, so that helps a lot. Thank you guys. And yeah, the $300 is pretty much going to pay for my hotel and travel to get there. So thank you, because now I don't have to pay for that. I really just need the money for my surgery now. And I've got, I don't know, about half, I think, saved. So hopefully I get this grant and it covers the other half. So right now, I have my surgery date scheduled for September 24th. Uh, I'm pretty excited. That is what? June, July, August, September. So in 4 months, almost exactly, I join the Itty Bitty Titty Committee. When I get my consultation, I'll let you guys know. I will post about it, I'm sure. And I get to talk with the doctor, so I'll let you guys know everything. Right now, I've heard nothing but good things about her. So far, it seems like you really have to be on them. Otherwise, you're not going to get your consultation. I first emailed the patient consultant. I called the number. If you Google Dr. Corey Agarwal, there's a number for the University of Utah. If you call that number, you ask for Felicia. She's the patient consultant. And she emailed me right back with a sheet that I had to fill out for a new patient. And that all went very quickly and smoothly. So far, the doctor was out of office for about a week, so that held things back a little bit. And now we're trying to work around my schedule and the doctor's schedule to get a consultation time. So that's what's taking me a while. But we reserved a spot for me on September 24th for my surgery. Because I've been back and forth with her about my consultation, and around the time that I plan on surgery, we've talked about it because I'm out of state and everything else, and so we've set a time where that's my date. It's reserved for me. So I haven't paid any money yet, probably because I haven't had my consultation, but as soon as I have that, I'm assuming they're going to give me some kind of like pre-surgery packet kind of thing where you have to do this and this and this. I have heard from other people that you have to go get a mammogram, but I'm not sure that I'm old enough that it's required yet. So I guess I'll let you guys know that too. Yeah, that's where I'm at so far. I pretty much restarting school, and life is good right now. we plan to We've been looking to buy a piece of land, and I think right now our goal is we're gonna buy some land, build a little tiny house, like the kind you see Google tiny house. That kind of tiny house. Uh, Live in it for a couple years till we pay everything off, and then build a big house, and then use the tiny house as a guest house. Um, Pretty sure that's what our plan is, and anyone's welcome to visit us whenever you want. Just saying. So, uh, that's my life update. Thanks for watching, and I will continue to let you guys know what's going on. Thank you.